Types of bipolar disorder. There are three types of bipolar disorder: bipolar I disorder, bipolar II disorder, and cyclothymia. They have different diagnostic criteria based on their symptoms and duration. Bipolar I disorder. The criteria for bipolar I disorder include trusted source. 1. Manic episodes that last at least 7 days, or manic symptoms severe enough they require immediate medical care. 2. Possible depressive episodes, typically lasting up to 2 weeks. 3. Possible mixed episodes of both manic and depressive symptoms. Bipolar II disorder. Bipolar II disorder involves periods of hypomania. Depression is often the dominant state. For a diagnosis of bipolar II disorder, a person must have had 1 or more episodes of depression. 2. At least one hypomanic episode. 3. No other diagnosis to explain the mood changes. A person with hypomania may feel good and function well, but their mood will not be stable. There is a risk that depression will follow. Cyclothymia. The National Health Service, NHS, in the United Kingdom states that cyclothymia is a mild form of bipolar disorder. Also known as cyclothymic disorder, it involves trusted source recurring symptoms of hypomania and depression that are not intense enough or do not last long enough to qualify as full hypomanic or depressive episodes. Diagnosing bipolar disorder. A mental health or healthcare professional can diagnose bipolar disorder using criteria set out in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, DSM-5-TR. The NIMH trusted source explains that to receive a diagnosis of bipolar I disorder, a person must have experienced symptoms of mania for at least 7 days, or fewer than 7 days if symptoms were severe enough to require hospitalization. They may also have had a depressive episode lasting at least 2 weeks. To receive a diagnosis of bipolar II disorder, a person must have experienced at least one cycle of hypomania and depression. A healthcare professional may perform a physical examination and order some diagnostic tests, including blood and urine tests, to help rule out other causes of symptoms. It can be challenging for a healthcare professional to diagnose bipolar disorder. People are more likely to seek help with a low mood than a high mood. As a result, it can be difficult for a healthcare professional to distinguish it from depression. If a person has psychosis, a healthcare professional may misdiagnose their condition as schizophrenia. Other complications that may occur with bipolar disorder are: 1. Substance use to cope with symptoms. 2. Post-traumatic stress disorder, PTSD. 3. Anxiety disorder. 4. Attention deficit hyperactivity disorder, ADHD. The NIMH trusted source urges healthcare professionals to look for signs of mania in the person's history to prevent misdiagnosis. Certain antidepressants can trigger mania in some people. While a person with bipolar disorder may experience periods of neutral mood without symptoms, bipolar disorder is